This conference will now be recorded.
Good morning, everyone, and welcome to Coffee with NAHRA. My name is Janet Borland. I'm the Association Director for the National Native American Human Resources Association. And for those who are with us for the first time, NAHRA is a tribal led nonprofit organization focused on the HR profession and tribal leadership development. We are now in our 28th years of existence, and we're continuing to advance and advocate for Native American tribes. We are super excited today to have Mark Patrick from Alliant, and he's going to be showcasing the new NAHRA Value Add program. Tribal member benefits now available, NAHRA Group Life Insurance targeting at a 10% savings, no cost benchmark steady, and an optional LTD STD purchasing available. Today's overview will be about 35-minute overview. It's going to be recorded and will be uploaded in our NAHRA YouTube channel this Friday. And please make sure that you utilize your chat box. Your mics are off so we can hear Mark's presentation. And thank you, Mark, for joining us today.
It's really an honor to be here, Janet. Thank you
Cool.
very much
Without
for having
further
me.
ado, I pass it over to you.
Terrific. Hopefully you can hear me okay. It's a huge honor to be here. Thank you so much for your time this morning. And as Janet said, we'll try to be very respectful of that. As she mentioned, my name is Mark Patrick. I work at Alliant. We're one of the larger brokerage firms across the United States. I think the last I checked, we were seventh largest broker in the country. Um, And we have been working for well over a year with NAHRA to build a program to try to save tribes money and add value to your overall benefit package. And we decided to start this with, quite frankly, probably the lowest hanging fruit out there, which is your group life and AD&D, accidental death and dismemberment insurance program. So that's really what we're focused on, is that and your voluntary life insurance. But as Janet said, there are options to take more advantage of what we've built with NAHRA. So what I'm going to do is just walk you through the program, and then we'll take questions at the end. Unfortunately, with my screens, I can't see chat. So please load your questions in on the chat platform, and then at the end, we will get to them and also have hopefully a robust conversation with anybody who wants to ask their questions live. So what is this program? And Janet kind of alluded to, through NAHRA, we've built, excuse me, I'm sorry, I'm fighting off a bug today, but we built what's called a group purchasing organization, or a GPO. And the idea behind it is, can we build some trust through NAHRA to you all for each tribe to try to save you money on a very simplistic commoditized benefit like your group life and voluntary life benefit. Now, on top of that, we do have some other options for each tribe. You'll notice at the bottom of my slide, we talk about burial benefits. We do have that option as well. So if you're interested in getting insurance that would pay back the tribe for any tribal member that your bylaws or constitution require you to either repatriate or help offset final expenses, we can write a policy for that as well. We're in the middle of bidding our first one through NAHRA right now. And we also have our first life insurance bid in, and I'm happy to tell you that it is coming in at our targeted 10% discount rate. So what is a GPO? And I want to make sure maybe the easiest way to answer that is, what isn't a GPO? You'll notice that under a GPO model, we're not asking you to change your benefits at all. If you like the life insurance, accidental death and dismemberment insurance, voluntary life insurance that you're offering your team members, you don't have to change one thing other than buy from the carrier that's partnered with NAHRA. So we will do a full contract analysis for you if you send us the information to get a bid, and we'll show you all the things that are inside your contract and how we've been able to match that. So if one tribe has, for example, 1 times annual salary with a minimum and a maximum, and another tribe might have just a flat $50,000 or $100,000 death benefit, we can meet each tribe's needs to match exactly what you've got, and also make suggestions on how we might be able to enhance your contract. The second bullet you'll notice there is, this is not an association. I'm not a huge believer in association plans. I can get into a lot of detail as to why that's the case, but the bottom line is, with associations, all the groups are sharing risk together. So one group will ultimately subsidize another group. On a GPO, that's not the case. Group purchasing organization is really just saying to one carrier, look, through NAHRA, we're willing to all buy from you. So we want group purchasing discounts. Volume rules the world in life insurance. So what we're trying to do is build a very large pool of employees, which will drive down rates for everybody while maintaining individuality one tribe to the next. We are focusing, as I've said before, only on group life, group AD&D, and voluntary life. Having said that, if your tribe is interested in this, it says, I really want to support NAHRA, first of all, and I'd love to save some money, then if you wanted to package your short-term and your long-term disability with us, there's certainly nothing to prevent you from doing that. We can actually, it's in our plan to over time offer the same group purchasing organization model for that. But to start with, what we're really asking for is something super simple. Just give us your life insurance pieces, let us bid those out, and if they save you money, you win. If they don't, then no harm, no foul, and we understand why you wouldn't want to move your products. So what is a group purchasing organization, and is this something relatively new? The answer is it's not new at all. You're probably familiar with them under different names. If you've ever been involved in a captive, for example, captives are nothing more than group purchasing organizations with a bunch of wrinkles in them. At Alliant, the company I work for, we actually already have a group purchasing organization or a GPO for healthcare employees. And we've been able to grow that to about 350,000 different employees with different healthcare facilities across the United States. And the value is the bigger the pool, the more aggressive the underwriter gets for our life and disability insurances in that population. Another good example is I live in the state of Washington. Every public school employee in the state of Washington has to purchase all of their benefits, medical, dental, life, disability, whatever, through a single entity, a group purchasing organization that gives them the ability to lower the rate for those school district employees across the state. So when I'm telling you what we're trying to build here at NAHRA, we know we're going to need time. We know this is going to take 2, 3, 4 years to really build up critical mass. But we believe we'll be able to build a pool of 50, 60, 100,000 employees across the country in the next 2 to 3 years. And for those tribes that are investing with us, we're really hopeful to save quite a bit of money over the course of the next 3 to 5 years. So that's how it works. Why would you want to consider it? Well, as soon as you participate, it's our goal that every tribe would save roughly 10%. I can't promise that because, as you know, that it is a risk business in insurance, and each tribe is going to be looked at based on the information they send in. The more information we get, the more aggressive the rate we can get with our underwriter. But here's our goal, that we would save you 10% on your life, group life, and voluntary life policies if at all possible. The second thing that we're willing to do is take a look at the contract you have today and hopefully offer enhancements to that. What might those be? Well, for example, there might be a seatbelt benefit that has fallen behind the times and that we might be able to build a better benefit for you with no additional cost. Or maybe your guarantee issue limits aren't where we think they should be, and we might be able to bump those up for one tribe that had too low of guarantee issue and give your employees an opportunity to buy more life insurance if that's what they want without medical evidence. Our goal is to make this as easy as possible for you. I know how busy you all are. I know the last thing you want to do is shop a line of coverage that doesn't feel broken, but the goal is to build a very large pool very quickly so that we can take advantage of those premium reductions and better contract provisions. So once you send a request for quote in, and I'll show you what we're going to need to do that, our commitment back to you is you're going to get 2 things for free whether you buy the product or not. The first one is a full contract analysis. So if you send us your group life policy and your voluntary life policies, we, Alliant, will take the time to dig through those policies and make sure you know all the little bells and whistles or maybe gotchas that are in your contract that you may want to clean up, whether you buy it from us or not. The second thing that we're building is a benchmark database. So each time a tribe sends in a request for quote, part of that request is going to be a summary of their benefits. And we at Alliant will start building a benchmark system where we'll be able to send back out to every tribe that sends us their information, whether they buy or not, a benchmark study that says, okay, here's you, and here's the blinded benchmark results from all the other tribes around the country. We're not going to tell you which tribe has what benefit, but we are going to say, here's where you stack up against these 10, 15, 20, 30 tribes as we go. And then we'll aggregate that data for you to say, if you were the quote unquote average tribe, these are the benefit levels you would expect to have, and this is where you are. So you're behind or ahead or equal to the national standard. So we think there's some value in it, regardless of the price point. But obviously, the key is try to get you, some money savings back to you and your team members. So if you'd like to play, if you'd like to at least get a quote and take a look, these are the things we're going to need. Excuse me. The first thing we're going to need is a census of everyone who's eligible for your group life and AD&D benefit and your voluntary benefits. So basically, full-time employees and team members. On that census, by the way, we have a template that we'd be more than happy to send you so you know what we're looking for, or we'll take any template you already have, as long as we have the general information we need, which would be the gender, the age, the zip code, the salary if you want us to shop on an increment of salary. And again, we'll work with each tribe to make sure this is as easy as possible. So we need the census. The second thing we'd love to get our hands on is the current contract and the rates you've been paying over the last 3 to 5 years. So if you're on a 2-year rate guarantee or a 3-year rate guarantee, we'd love to at least see 2 renewal cycles, hopefully 3 renewal cycles on what you've been paying with your current carrier, and then get that contract. Or if you don't have the contract or can't, it's too inconvenient, a benefit summary would suffice. When we get the benefit summary though, I can't do a full contract analysis based on a summary. I'd really rather get the full contract, because then the value of us doing a full analysis of your contract obviously is substantially better. And then if you're a tribe over 1,000 lives, we really need your experience rates over the last 5 years. How many deaths have been against your current carrier? That would be very helpful for us to aggressively negotiate with our underwriter through the insurance carrier that we're using. If you're under 1,000 lives, we're not going to ask for experience. We just need those rates over the last 3 to 5 years. Would be extremely helpful. Without those, frankly, I'm going to get a very conservative bid and probably waste your time, and we're not going to be able to save you a lot of money. Okay, so that's the life insurance program. As I said, I'm trying to be sensitive to time. Are there any questions on that program before I shift to a second value that I think has even more interesting legs to it? I'm going to pause here.
Hey, Mark, this is Judy Wright.
Yes, Judy, hello.
Hello. Hey, just for clarification, when you said that you need your company with over 1,000 lives, is that 1,000 lives covered under the plan, or just 1,000 head count at your company?
Head count. Head count, okay. Not covered. Okay. Yeah. So if you're not covering 1,000 people, just those rates will work. But yeah, thanks. Great clarifying question.
Thank you.
You're very welcome. Good to hear your voice.
Mark,
yes. Yes.
So clarification, you may mention this. I just want to be clear too. So this is potential coverage for employees, but also could be for the tribes that are covering for tribal members. Is that correct?
If the burial insurance, Tal?
Yeah.
Yes, the burial insurance is specifically for tribal members. Thank you for the clarification. The group life, AD&D, and voluntary life would be for employees / team members of the tribe. So they're 2 different products, but thank you for clarifying. The burial insurance is for those tribes, and I think just about everybody has some provision in your bylaws that says at end of life, this is what the tribe is committing to do on behalf of each tribal member. So we can actually write a policy that would come in and reimburse the tribe back for those expenses. Normally, what we see is a $5,000 benefit, a $10,000 benefit, or maybe a $15,000 benefit. And then the tribe is paying out maybe a little below that, a little above, depending on the person. We wouldn't write a policy that says, well, if you spent $7,452 on this person's end of life, here's your check. It's going to be a flat dollar amount. And I'll work with each tribe. There's more information we need on the burial than what I just showed you on the group. And I don't want to bog the meeting down, because that we're going to need like your constitution, your death rolls for the last few years, etc. But if you're interested in that policy, we can certainly do it.
Thanks, Mark. Good clarification. And I'll just add that for the tribal government side, for tribal members, it could be covered under the tribe's general welfare code. So, that cost can be covered there. And while I have you, I'll just, there's a question in the chat. Is
Yes.
this also available to nonprofits? Patty's asking.
If they're tribal-owned nonprofits, yes.
Okay. And Patty, if you have further questions, feel free to add into the chat or join in. Thanks, Mark.
Thank you, Tal. And I want to apologize to everybody. I don't have access to the chat. I'm not a real good go-to meeting person. We're a Zoom company, so I'm in foreign land here, but we'll get through it. So that was the life, accidental death and dismemberment, voluntary life, and the burial insurance policies that are all available. That is directed at your employee base plus the burial for your membership. But I've also heard, and we talked about this, we kind of alluded to it at the Wild Horse Pass conference in Phoenix last year, that we were going to be rolling out this new program for tribal members. And that's what this slide is talking about. This is a first, and quite frankly, one of the only organizations in the United States launching this program this year is NNAHRA. It's a very unique program, but I want to be very, very clear about something. This is for your tribal members who are not working for you. If you already have voluntary benefits, AFLAC, or some company like them, for example, First Colony or Colonial or Unum or somebody like that, for your voluntary benefits for your employees, I would not replace that plan with the plan I'm offering today. This is a plan that gives every tribal member the opportunity to purchase an AFLAC program on their own, with their own money, with no HR involvement, running it through a debit card payment, just like they would buy something on Amazon or whatever website they're purchasing from. So I think it's a very, very unique program, but I don't want to confuse you. There are differences between the individual AFLAC program, which is called Tier 1, as you see at the top of my slide, versus the group AFLAC. So if you have AFLAC already for your employees, do not replace it with this product. But if you have a number of tribal members who have always asked, can we be on your medical plan? Or how do I get benefits through the tribe? This is now an opportunity to give your tribal members a benefit that they may see a lot of value in through NNAHRA. Here's how it works. It's really quite simple. Each tribe that's interested, we will set up your own URL, your own website within Tier 1, which is what AFLAC calls their direct-to-consumer platform. This is the best part of the whole program in my mind. All HR is responsible for is sending the information out to your tribal members and explaining the program. And by the way, I'll do that for you. If you want to set up a web call with all your members, if you need email campaigns, letter campaigns, whatever it is you want, Alliant will help you market this program to your tribal members. Here's the beauty. No payroll deductions, no billings come to HR. HR is not going to get involved in claims processing or claims questions. There's an 800 number from AFLAC for your tribal members. That's why I said this is different than your group AFLAC program versus this online direct-to-consumer program for your membership. For your tribal members, why would this not be as good as the group program? Well, as an employee at your tribe, if you're offering AFLAC, I can purchase that product pre-tax if I want to. Under this program, I can't do that. It's a direct-to-consumer purchase through the website, through online purchasing of your tribal member. So that's one example where the benefits are better on the group side. Their contracts are different. They're a little bit more lucrative on the group side than they are on the individual. But as I said, if you've always struggled with having tribal members say, I really wish I could buy some benefits through the tribe, this is your opportunity to start that process. I'm going to walk you through what it looks like. This won't take long, but I just kind of want to give you a feel of how this program works. So you as the HR team at your tribe sends this out to every tribal member with a letter that says, hey, there's good news. Scan this QR code or go to this link or whatever you want to do. And now tribal members, you have the opportunity to purchase some AFLAC products on your own. This is the first screen they're going to see. When they come on board, all they have to do is say, what state do I live in? What's my age? And who am I covering? Me, my spouse, my family, both of us. How does it work? Once they decide what they want, they hit the get a quote button. Let me go back and show you that. So get a quote was right here. That'll light up once they load this in. Then they can choose to get a quote. Once they do that, this screen pops up and says, okay, would you like to buy a critical illness policy, a cancer policy, an accident policy? We can, over time at NAHRA, load in dental insurance, vision insurance, hearing aid insurance. There's lots of different coverages that we can start adding to as this program grows. But frankly, we wanted to make it simple, easy to understand for the member, and just stick with the best products Aflac sells, the most popular, which are their critical illness policies. So that's, for example, if I get cancer or stroke or something like that, not cancer, we have a full cancer policy, but a stroke, heart attack, significant health care where I'm going to have to go to the ICU, and then cancer, and then an accident insurance policy if I'm involved in an accident. So I might want to cover my kids for the accident and cover my spouse for cancer. You can certainly do that. You just have to log in 2 different times to buy your product. Once I decide on the products I want to see, I'm going to get details about that product. So I can now read up everything I want to know about those individual products. And I'm going to get a quote based on my age and my state. And it's going to say, do I want the standard, the plus, or the elite? So they can buy the level of benefits they want. Once they do that, they're going to enter in their name and some more information, and then they have to take a quick test. This is all it is. This is the eligibility questions. Very short, very quick, and gives your members the ability to purchase whatever program they want. Once they do that, they get a hard quote, because that first quote was, this is generally what it costs, but fill out your health information and we'll tell you what it's going to cost you individually. And then they load in their personal details, which would include their credit card number when they're ready to purchase. And they're off and running. If you're interested in sponsoring this program, and if you're interested in taking a look at your voluntary benefits, again, another value that Alliant's offering through NAHRA is just get a hold of me and send me all the information that you already have for your group products, and we will do an analysis with Aflac, because if you're sponsoring the individual plan for tribal members, it gives me a little bit of an ability to negotiate better group rates if you were interested in replacing your group plan with a NAHRA sponsored plan. Do you have to do that to take advantage of this program? Absolutely not. All you need to do is sponsor the tribal member program to have access to the tribal member program. But if you were interested, we might be able to give you a lower rate, even if you already have Aflac or if you have one of their competitors, because, as I said, Aflac has already committed that the more membership we build on the member side, tribal member side, the more aggressive they'll get on the employee side for your group products. I hope all that made sense. I know I'm kind of speeding through this at a speed that I'm comfortable with, but I've been working on this program for a year, so I'm pretty familiar with it, and I know you are. So let me stop here and just say, if you're interested in at all in the group life product and voluntary life product and you want more information, this is my contact. And if you're interested in the Tier 1 Aflac program for your tribal members, same contact. I'm going to work both of these programs. I have a full service team behind me here in the state of Washington to help everybody out nationwide. And I'm going to stop there at 9:25 and take any questions you have and potentially get you out of here a little early. I'm going to stop sharing. Are there any questions?
Yeah, there is one additional. Patty Petit, she was the one that asked about the available, is it available to nonprofits? And her response to that was, they're not owned by a tribe, they're freestanding American Indian nonprofits. So I'm thinking it's a native-led, such as NAHRA. Would it be available to a group such as NAHRA, an association?
Yeah, I don't see why not. I haven't been asked that specific question. I haven't negotiated that specific scenario. However, we've got a lot of leverage with our underwriters. So My short, without over-promising and under-delivering, I would tell you I would be shocked if we can't get that placed as long as it's tribal-led. As a nonprofit, I don't see an issue.
And Mark, I would encourage that review because NAHRA, we ourselves are looking for benefits at our employment level.
Mhm.
We work with the FOA in service of them in support of HR. They're looking at benefits. Patty, I'm sorry, I should know, but I don't know your organization, but there's many others positioned like us. So yeah, we'd like to have a report back on that to see availability. That'd be great.
Yep. I would say this, if it's the leadership team, the employees of the organization, the answer is going to be yes. If it's extending this to all the membership in that other association, that I would need to learn more about the association and then try to get that approved through the underwriter. So Patty, if you're talking about your own staff who's running the program for these other tribal entities, that I'm 99% sure I'm going to get that pushed through. But if it's, can I now make this available to additional association, I would really need to take some time and analyze that because we built this program specifically for NAHRA. We are committed to NAHRA 100%, and that's where the value lies.
Excellent. Well, thank you, Mark. This has been truly a really good presentation. I've included your email address
Thank you.
on the chat for everyone. I encourage everyone to please reach out to Mark. Mark, this is such an honor to have such a program such as this and working with Alliant Group and yourself. We thank you so much.
Well, I just want to leave you all with thank you very much, and we're really honored to be a partner of NAHRA, and we are committed to supporting NAHRA at Alliant in a significant way financially and socially. I just believe in everything you're doing, and would just love to grow this program to help everybody within NAHRA and NAHRA itself add more value to your membership. So I really appreciate your time. Thank you.
Great, thank you. And for everyone, once again, this session's going to be recorded. It will be on our YouTube channel on Friday. And please feel free to share it with other tribes. It's such a wonderful program to be involved with.
Janet, may I, since we have a minute, can I
Yes, please.
share some information since Mark is a participant in this on our annual summit?
Please.
Can I provide? Okay. Some of you may be enrolled or registered, but May 22nd, 23rd, take a look at the NAHRA website. We've listened to you, the members, as to a topic of focus. This year's annual summit, every year, NAHRA focuses on one particular topic. This year, our focus is on compensation and benefits. Mark has graciously agreed to be a speaker. He's going to MC one of the panels on best practices. But we have an agenda that's going to be, well, it's already posted, but we have a very detailed agenda that's going to be posted yet this week. We would be honored if you join us. Mutual of America is hosting us at their beautiful headquarters in Manhattan in New York City. So an exciting place to be, of course, but more important is the topic itself. Mark, you want to take just a minute and overview the topic you're going to be presenting? It's outside of this scope. It's completely different, but very interesting topic.
Yeah, sure. Way to put me on the spot, Tal. I love it.
You're welcome.
Yes, I'm actually really excited to talk about this. As you are, I'm sure, all aware, and I noticed NAHRA is having a coffee talk similar to what I'm going to be discussing in New York, but the future of prescription drugs and what's going on with the prescription drug spend in the United States. Obviously, the buzzwords right now are around GLP-1s, which you may not know what the GLP-1 is, but once I tell you their brand names, you're going to immediately recognize Ozempic, Wegovy, Mounjaro. What about these drugs that were designed to combat diabetes, but the side effect is losing 10, 15, 20% of your body weight? What are the long-term implications of covering those drugs? What are the short-term costs? And what should an HR director be thinking about? On top of those drugs, the next wave of real concern is in the form of genetic drugs. So now what we're entering into is an era where the Human Genome Project back in the 70s and 80s, because it was in the 80s, designed such that we were able to rip apart the DNA, and now we're building customized genetic drug therapies that are solving health conditions we've never been able to solve before. Children born blind, in some cases, can take one pill one time or one injection one time and see perfectly the rest of their life, which is unbelievably important. But it comes at a price tag of $1.2 million. And is your health plan ready for the wave of genetic drugs and drug therapies that are coming, and what can you do to protect your plan? So there's a lot going on in the drug industry that's making front page news every day about the federal government. And we're going to spend some time talking about what is the current state, what is happening that's going to grow healthcare, both successes but also costs, and what can you as a plan manager do about that? So it's going to be a very interesting topic.
Thank you, Mark. I'm glad I put you on the spot and you were ready for it. So appreciate that. So just to get the summit, day one is going to be focused on compensation, best practices, what's going on in the market currently, what's the trends, how to develop an RFP, what is a survey to a study, those kind of conversations are going to take place day one. And then Mark joins us on day two with a number of other great speakers with a focus on benefits. For example, a topic of what are the 10 questions you need to be asking your broker as you go into renewals, things like that. Very interactive. We'll have about 75 of your colleagues in the room. So please think about joining us. If not, just stay tuned because we'll be sharing some resources as we gather from folks like Mark and others. And we'll share that on our members only resource page. Thanks, Janet, for letting me make the plug. And Mark, good job on being put on the spot. Happy
Thanks,
Wednesday,
Tal.
everybody.
No, thank you, Tal. Thank you. Once again, Mark, thank you so much for joining us today. And for those who want more information, I included the link for our Compensation and Benefits Summit, and hope we can see you there.
Thank you.
Thank you to everyone who's joined us today. Appreciate it, and have a great day. Thank you, Mark.
Bye-bye.